Scarlet fever is a bacterial infection caused by Streptococcus pyogenes, also known as group Streptococcus, the same bacteria responsible for strep throat. It mainly affects children between the ages of 5 and 15, though adults can contract it as well. Scarlet fever is characterized by a distinctive red rash, sore throat, and high fever, and was once a major cause of childhood illness and death. Today, it can be effectively treated with antibiotics, though complications can arise if left untreated. Overview: Causative agent, group Streptococcus gas. Contagion: highly contagious, spread through respiratory droplets, coughing and sneezing, contact with contaminated surfaces, and occasionally through skin contact. Typical age group: primarily affects children but can occur at any age. Symptoms usually appear 1 to 4 days after exposure to the bacteria and include sore throat, often severe and similar to strep throat, with pain during swallowing. Fever, usually above 101 degrees F 38.3 degrees C, often accompanied by chills. Rash, appearance, red, sandpaper-like texture covering most of the body. Location, starts on the chest and abdomen, then spreads to other parts. Other features: the rash tends to be more pronounced in skin folds like the armpits and groin. Strawberry tongue: the tongue may appear red and swollen with a bumpy texture. Red lines: dark red lines may appear in the folds of skin, such as around the elbows, knees, and neck, known as Pasta's lines. Flushed face: the face may appear red, with a pale area around the mouth. Peeling skin: after the rash fades, the skin may peel, especially on the fingertips, toes, and groin area. Causes and transmission: scarlet fever is caused by toxins produced by group Streptococcus bacteria. It spreads through respiratory droplets, inhaling droplets from an infected person's cough or sneeze. Contaminated surfaces: touching surfaces contaminated by the bacteria. Direct contact: contact with an infected person's skin or through sharing personal items, like towels or utensils. Diagnosis: physical examination. Doctors can often identify scarlet fever by its characteristic rash and symptoms. Throat culture or rapid strep test. The swab from the throat can confirm the presence of group Streptococcus. Blood test. In cases where complications are suspected, the blood test may be ordered to assess the infection's impact. Treatment: antibiotics are the primary treatment for scarlet fever, reducing symptoms and preventing complications. Antibiotics: penicillin or amoxicillin, the most commonly prescribed antibiotics for scarlet fever. Alternative antibiotics: for those allergic to penicillin, alternatives like azithromycin or erythromycin may be used. Symptomatic relief: pain relievers. Over-the-counter pain relievers like acetaminophen or ibuprofen to reduce fever and throat pain. Hydration and rest. Adequate fluids and rest can help the body recover. Soothing the throat: gargling with warm salt water, drinking warm liquids, or sucking on throat lozenges may ease throat discomfort. Complications: if left untreated, scarlet fever can lead to complications, some of which are serious. Rheumatic fever, an inflammatory disease that can affect the heart, joints, skin, and brain. Kidney disease, acute glomerulonephritis, an inflammation of the kidneys, can develop after a strep infection. Otitis media, middle ear infection, common in children with untreated strep throat. Sinusitis, inflammation of the sinuses can develop from prolonged strep infections. Pneumonia, though rare, streptococcal bacteria can spread to the lungs. Post-streptococcal reactive arthritis, joint inflammation that occurs following an untreated strep infection. Prevention: preventing scarlet fever involves reducing the spread of group Streptococcus bacteria. Good hygiene: frequent hand washing with soap and water, especially after coughing or sneezing. Cover mouth and nose, using a tissue or elbow when coughing or sneezing. Avoid sharing personal items, Do not share drinking glasses, utensils, or towels with an infected person. Stay home. Individuals diagnosed with scarlet fever should stay home from school or work until at least 24 hours after starting antibiotics. Prognosis with prompt treatment. Most cases of scarlet fever resolve without complications. The rash and fever typically improve within a few days of starting antibiotics, and full recovery can be expected within a week. However, it's essential to complete the full course of antibiotics to avoid recurrence or complications. Conclusion: scarlet fever is a once feared childhood illness that can now be effectively managed with antibiotics. Early diagnosis and treatment are crucial to preventing complications, and maintaining good hygiene can reduce the risk of spreading the infection.